soon as that finishes playing, then you'll be on.
Right, okay.
After I finish my presentation, I might leave for prayer as well for 5 minutes, okay? Just to let you know ahead.
Okay, I'm about to start the webinar, and Kay, then we will go. Lisa, if you could just mute yourself, please.
Yeah, sure.
أعوذ بالله من الشيطان الرجيم الذي خلقني فهو يهدين والذي هو يطعمني ويسقين وإذا مرضت فهو يشفين والذي يميتني ثم يحيين والذي أطمع أن يغفر لي خطيئتي يوم الدين رب هب لي حكما وألحقني بالصالحين واجعل لي لسان صدق في الآخرين واجعلني من ورثة جنة النعيم واغفر لأبي إنه كان من الضالين ولا تخزني يوم يبعثون يوم لا ينفع مال ولا بنون إلا من أتى الله بقلب سليم وأزلفت الجنة للمتقين وبرزت الجحيم للغاوين وقيل لهم أين ما كنتم تعبدون من دون الله وقيل لهم أين ما كنتم تعبدون من دون الله هل ينصرونكم أو ينتصرون فكبكبوا فيها هم والغاوون وجنود إبليس أجمعون قالوا وهم فيها يختصمون تالله إن كنا لفي ضلال مبين إذ نسويكم برب العالمين وما أضلنا إلا المجرمون فما لنا من شافعين ولا صديق حميم فلو أن لنا كرة فنكون من المؤمنين إن في ذلك لآية وما كان أكثرهم مؤمنين وإن ربك لهو العزيز الرحيم.
Assalamu alaikum everyone and welcome. That was an opening recitation by Mumtaz Mansouri reading from chapter 26, the poet's verse in the Quran. My name is Zara and I will be moderating our conversation today. Many of us, including myself, are joining in this virtual space on the ancestral unceded Coast Salish territory of the Lekwungen people, known as the Esquimalt, Songhees, and Wasanic nations. For those of you that don't know, unceded means Indigenous peoples never legally signed away this territory to Canada. For immigrants, refugees, settlers, and first generations, it is our responsibility to honor, pay respects, and educate ourselves on the real history of the land that we live on. Moving into our focus for today, the topic of this dialogue is You and the Vaccine, a medical and Islamic conversation. There's been a lot of information shared in the community about the COVID vaccine, and many of us, including the Muslim community, are still hesitant or concerned about getting vaccinated. Acknowledging this, Masjid Al-Iman and here in Canada partnered up to provide a safe space for community members to raise concerns and get up-to-date and accurate information to their questions surrounding this topic. The live panel discussion, made up today of frontline workers, educators, and religious leaders, aims to educate the concerns regarding the rapid production, safety, efficacy, and benefits of the vaccine. Islamic perspectives on vaccination will also be explored in this discussion, as Imam Ismail of Masjid Al-Iman will share what the Quran says about seeking a treatment for disease and the social responsibility of Muslims to prevent the spread of disease. Just so you know, we will be live streaming this dialogue on YouTube and welcome participants to share their questions through the Q&A box that you see in Zoom and also in the chat line within the YouTube space. So before we begin, it would be great to get a measure of where we all stand with understanding vaccines. So on your screen, you will see a pop-up that you can answer anonymously, and it will be kept up just for a minute. So we just want to get a baseline understanding of where we're all sitting at today as we join into this conversation. So the question that you see is, what is your level of understanding about vaccines? The first response, I know a lot about vaccines, but I couldn't explain them. I don't know anything. I know a little, but I want to learn more, or I know a lot. So I'll give you 30 more seconds just to answer this quick question. Just a few more responses. If not, we can close up just now. Give you 5 more seconds. All right, so we'll end the poll there. And just so you know, it seems like everyone here knows a little bit, but wants to learn more, which is great. And so this is exactly why we're having this conversation today. So to get into our panel today, it's comprised of 4 individuals that are really bringing in their insights and backgrounds as leaders in their own right. We have with us this evening Sister Asma Shafia, a registered nurse, Faiza Haj Ibrahim, a pharmacist, Dr. Srinivas Murthy, a clinical associate professor, and lastly, Imam Ismail Noor, the Imam of Masjid Al-Iman. So for our first panelist, I want to introduce and welcome Dr. Srinivas Murthy. Dr. Murthy, again, is a clinical associate professor in the Faculty of Medicine at the University of British Columbia. He is the Innovative Medicines Canada and Health Research Foundation Chair in Pandemic Preparedness Research. He will share information about what viruses are and what makes COVID-19 particularly contagious and dangerous. He will also share some ways on how to be prepared for this pandemic. So I welcome to the floor, Dr. Murthy.
Thank you, Zara. I don't want to take too much time because I think everyone has heard about this virus over this past 15 months now of us hearing about it constantly. But to be brief, this virus, this coronavirus, we think emerged in late December, early January 2020. And a virus is a funny organism in that it doesn't live on its own. It needs someone else, like humans, to live with. And when it infects us, it basically takes our cells and allows the virus to reproduce itself. And with that process, it's able to go from person to person and cause disease and sickness in people who have it. And so all of the things that we've been doing for the past 15 months have been protecting ourselves from getting the virus from others in our community around us, wearing masks, staying home, having stores closed. All of those things mean or help the virus not go back and forth between people. And if the virus can't go back and forth between people, the virus won't survive. And that's really the way you get rid of the virus in your community, by giving it, or by taking away its opportunities to infect new people. This special virus, this coronavirus is a tricky virus, and obviously we've been trying to solve it over the past year and a bit now. And it's tricky for a couple of reasons. The first reason is that it's very transmissible, meaning one person can very easily give it to another person, much more than other viruses that have been sort of circulating in prior years, things like the flu or other things like that. And the second thing is that it can cause bad disease in lots of people, and specifically people who are elderly, and specifically people who may have other conditions that worsen their health. And so if you have those things, we worry about getting the virus and want to make sure those people are especially protected. The third thing that makes this virus especially tricky is that a bunch of people can have the virus and not even know they have it, meaning something you've probably heard on the news, such as asymptomatic transmission. And what that means is that you can be perfectly well and not have any symptoms at all, but still have the virus and be able to transmit the virus to people around you. And that's what's led to lots of sort of what we call lockdowns or other times where we've had to stay home to avoid transmitting the virus through no fault of our own. Even though we're completely symptom-free, we may still have the virus and be able to transmit it to other people. So those things have made this a very challenging virus to overcome. And especially because once you're sick with the virus and actually have symptoms, outside of once you get to the hospital, getting some medications once you're in the hospital, we don't really have much to prevent you from getting worse, to avoid going to the hospital in the first place. And so mostly it's staying home, getting rest, making sure you're getting all of the nutrition and fluids you can get, and hoping that your body can help fight the virus off. And that's really what we've been doing over these past number of months. And hopefully no one on this call has had this disease, because I know many people around me have, and it's not a very pleasant experience. And even though you don't end up in the hospital, you still might end up quite ill at home. For those of people who end up in the hospital, who I see in my ICU all the time, it's especially concerning because they can be very, very sick. And that means they'll have lung problems and heart problems and blood clotting problems. And a lot of times will have long-term effects after they leave the hospital. And so it won't just necessarily mean you get out of the hospital and everything is fine. It means that there's still problems with your strength, with your energy, with your breathing, and so on, even after you leave the hospital. There can even be long-term conditions for those who don't even make it to the hospital, namely those who have pretty mild symptoms, but those mild symptoms can go on for many weeks and sometimes even many, many months. And we're still learning about a lot of these conditions as the past year has emerged. And so when we heard, 4 or 5 months ago now, that the vaccines were available and the vaccines were approved, and we had good clinical trials to look at those vaccines and say that they are safe, and most excitingly, they are effective. Obviously, many of us in the clinical community and the larger communities around the world rejoiced. It was excellent news and wonderful to see the data that's emerged, because we've all seen the problems that this virus has caused. And the way out of it is to get this vaccine as readily available to people who can have it as much as possible, as quickly as possible, over these coming days, weeks, and months. Many people have been vaccinated in British Columbia over these past 3 months. Hopefully over the coming 3-6 months, many, many, many more will be vaccinated. And the hope is that, and I think some of my fellow panelists will talk about these vaccines in more details as to how they work and what they are doing to help protect your bodies against this virus, because they are fascinating parts of how science has developed great vaccines to help protect us. But just sort of to finish up, because I don't want to take too much longer, over these past 15 months, this vaccine, or this virus, has caused a great deal of problems and caused a great deal of death and dying around the world. And I think our pathway out of it, and we've learned quite a bit about this virus, our pathway out of it is with this vaccine and the vaccines, sorry, that are emerging, and being able to use them as well as possible. I'll stop there. I'm happy to answer and talk some more.
All right, perfect. Thank you so much, Dr. Murthy, for educating and informing us of just the process and everything that comes into vaccination. Jumping on to our next panelist, we have Sister Asma Shafia. She is a registered nurse. Asma has a bachelor's degree in nursing and works in acute care settings, including cardiac, surgical, gastrointestinal, and respiratory wards. She will share her experiences of COVID-19 positive patients, and she will also explore common vaccination myths and misconceptions. She will also discuss COVID-19 vaccines and how it works, its efficacy, and possible side effects. So I welcome you again onto the floor, Sister Asma.
Oh, sorry. You know, I prepare the PowerPoint. I don't know if you can show them. Already, Dr. Murthy already explained about what's sign and symptom. He already mentioned about the precautions. I don't have to mention it, but let's go to the, and then you did introduction already. Can we go to the second one? And just jump down, skip that one. Can you go to the my experience? Okay. All right. So first of all, you mentioned about, I'm going to talk about the vaccine, the side effect, and then the efficacy. That's Faiza. She's a pharmacist. I think she's going to talk about that. So just skip that one as well. So most of the, as Dr. Murphy said, most of COVID-19 infections can be managed at home while isolating for 14 days and will not require hospitalization. Patients who experience severe symptoms such as shortness of breath and or difficulty breathing need to receive hospital care. I'll be sharing some experience that I personally have witnessed working as a nurse in the hospital during the pandemic. Some of the challenges I have seen patients and even healthcare professionals struggle with are stress. Patients are stressed from being sick and hospitalized. Patient can get anxious from the unknown or contradicting information from what they read or somebody give them the information versus what the healthcare professionals advise them. Not being able to recognize the faces of their healthcare providers can also induce fear. Every healthcare providers have to wear personal protective equipment, PPE, such as a gown, surgical 95 mask, gloves, and face shields or eye protection when they enter patient's room. Not only the patient stressed out, but also the healthcare providers are stressed as well because it consumes time and effort to properly wear and take off protective gear according to the infection control guidelines. Also, there is a great concern for contamination and spreading to the other patients, to other patients and onto themselves. When patients are stressed out, the immune system becomes weaker, which takes them longer to recover and requires longer hospitalization. This can continue the cycle of the stress. Another one, isolation. Patients feel lonely because in many cases, they are not allowed visitors. They are isolated in their rooms. They cannot visit with other patients due to transmission of the virus. Patients stay in the hospital are encouraged to bring their digital device, such as cell phones, tablets, or laptops, so that they can stay connected virtually with their loved ones during their stay. However, this is not the same as having your loved ones beside you during the challenging times, especially for those in palliative care. Families with patients in palliative care allowed only one single designated visitor to support the patient. Visitors are only allowed to visit once per day. This is very challenging. Many palliative patients pass away alone without their families around them. For other patients who are not in palliative care, their family are only allowed to bring essential items and drop off at the main entrance of the hospital. There are many challenges, but one of them is stigma as well. Stigma, in some cases, initial life-saving actions such as early screening and treatment are avoided due to stigma. Stigma hurts everyone by creating fear towards the person instead of focusing on disease that is caused the problem. Stigma can also make people more likely to hide symptoms or illness, keep them from seeking health care immediately, and prevent individuals from adopting healthy behaviors. This means that stigma can make it more difficult to control spread of an outbreak. Stigma can make people feel guilty or bad about themselves if they are positive for the virus. Stigma can also increase anxiety as the person has to worry about how to manage it. This also goes for the healthcare professionals, as people can be fear of someone who works with the COVID positive people. Most places will prescreen for COVID, thus making it difficult to access services at time. A personal example for me would be when I went for a massage and a masseuse did not feel comfortable and refused service due to me working with the COVID patients. Many COVID patients who come to the hospital acute care setting require oxygen via nasal tubes. We will monitor them for a few days until their oxygen level in a normal range. Once they don't require oxygen and then their symptoms improve, they are discharged from the hospital. However, for some patients, their symptoms will get worse, struggling to catch their breath or become so weak and deteriorated that they need to go to the intensive care unit, ICU. They will require intubation, which means their breathing is supported by a ventilator. While they are on the ventilator, they are heavily sedated because they can become delirious and agitated and may try to remove the ventilation tube. Not only are these patients on the ventilator, but they are also connected to many other tubes, including a heart monitor, Foley catheter because they can't go to the bathroom, and central lines or IV intravenous lines to administer many medications. After ventilation and hospitalization, some patients recover their breathing independently, although complications due to COVID are still persistent. Because of this, it's important that the patients still monitor closely after discharge from ICU to ensure no further complications. Another factor is being bedridden for extended period of time can lead to muscle deterioration and make mobility difficult. They lose their muscle tone and will require physiotherapy to build the muscle back up. Can you go to the next level for me, please? I would like to share a good example of an ICU patient who was discharged from Johns Hopkins Hospital in the state last year. Ahmed is a young 40-year-old man who was a marathon runner and a boxer. He was in great shape until he contracted COVID. The experience had nearly killed him. Ayad had a blood clot in his left arm and damage in his heart and lung, all complications because of COVID-19. During his time in the hospital, he lost more than 60 pounds. Ayad had stayed in the ICU for 25 days and was discharged April 22 of 2020. Although Ayad had recovered gradually over time, it was a very scary story for many young and healthy people because of the recognition that anyone can get COVID no matter how healthy or young you are. And I have the link. If anybody wants to read more about Ayad Ahmed's story, you guys can click this link. Maybe Zara can send it for you. Can you go to the next level for me, please? Thank you. I believe the COVID, many people refuse to get a COVID vaccine once it's available. Conspiracy theory about vaccine have circulating among anti-vaxxer groups and viral videos, but there is no scientific studies behind it. Most popular conspiracy theory is Bill Gates has secret plan to use vaccines to implant tractable microchips in people. Another theory that in pandemic, Covet falsely claims that any COVID vaccine will kill millions, and that other vaccines have already done so. In truth, vaccines save millions of lives every year. Before a vaccine is approved, it must generally undergo 3 phases of clinical testing to show that it's safe and effective in a large number of people. Many people are concerned about the short period of time it took to create the vaccine. However, there are few things to consider. First, pandemic is a global problem and has many nations working together to solve the coronavirus. This increased focus and funding behind scientific research and accuracy. As well, technology has developed exponentially over the years, which has greatly impacted the speed of discovery. Therefore, with the concentration of multiple nations and pharmaceutical companies and the development of technology, the COVID vaccine was able to be created at much faster rate compared to other vaccines in previous years. Vaccine doesn't cure the illness, but it protects us from having the serious symptoms and complication from the illness. Can you go the next, please? So COVID-19 brings upon serious life-threatening complications, as I have mentioned it before, even though it affects certain groups less seriously than other based on age, health, other factors. It's still impossible to predict how COVID-19 will affect any individuals. If the patients who are COVID positive had been vaccinated originally, the severity of illness would most likely have been less serious, especially considering the emotional trauma that comes with the experience. Getting vaccinated creates an antibody response so that we are protected without having experienced the illness. If patients were able to be vaccinated much earlier on, the severity of cases would be much lower. COVID vaccine is safe, as Dr. Mercy say, and it's very effective. It helps reduce the amount of people getting sick from the virus. Getting vaccinated protect the people around us, particularly our elderly population and immunocompromised people at high risk from severe illness of COVID-19. We must think our community, our city, our country, and the world in large. To protect our families and our loved ones, we must build immunity. So at the end, can you go the last one? And so COVID can be serious. Complication can lead to hospitalization. Anyway, I don't have to repeat about the follow public health guidelines, because you already know, wash hands, wear masks, all the stuff. So vaccine is not dangerous. They are safe, effective, and will save lives. Vaccine helps our body to fight against the virus, protect our family, our community, and our country by following guidelines and getting vaccines, herd immunity. Thank you for listening.
Wonderful. Thank you so much, Sister, for sharing your experiences and also just your courageous leadership as a frontline worker during this pandemic. Hopefully, alongside Dr. Murphy's introduction, we've cleared up some misconceptions about COVID and the vaccine, which is really critical to the dialogue that we're having today. So just because we've had a kind of a mid checkpoint before our next two speakers, I'd love to introduce a poll. And so this poll will kind of gauge to see how much you kind of understand about how mRNA vaccines work. So a pop-up on your screen should come up, and the question is true or false? mRNA vaccines will alter your DNA. So we'll give this a couple minutes. And in the meantime, we already have some questions coming through in the Q&A. So just so you know, feel free to always put them in the Q&A chat as we're going along this dialogue. I know questions probably come up when you're hearing our panelists speak, and so putting them in whenever you think of them is great, and we'll address these at the very end during a Q&A period with all our panelists. So we'll give it a couple more minutes for this mRNA vaccine question. Also, for those Muslims that are in the room as well, we know that prayer time is coming up. So if you need to step away from those as well, feel free to do that during this time if you'd like. Right, so there's still a couple of you that have not answered. So this is again just a content and to see if you are engaged or if you're just walking away from your computer or something. But we will share the results of this. So it seems like we have a good consensus that this is false. So it feels like we've heard some great dialogue from Dr. Murphy and Sister Asma. So we've kind of got a good understanding, and we'll deep dive into this a little bit more if there are some misconceptions about this concept as well. Perfect. So we're jumping in our schedule. We're even faster than we were anticipating, so that's awesome. So if you'd like, I'd like to invite our next panelist, Sister Faiza Haj Ibrahim. She is a pharmacist. She's a pharmacist manager with a Bachelor in Science in Pharmacy and a Master's of Science in Biochemistry. She will share information on how the COVID-19 vaccine works from a pharmaceutical perspective. So welcome to the floor, Sister Faiza.
Oh, thank you, Zara. Thanks for inviting me for this panel. I'm so happy to see that everybody voted for the that mRNA vaccines will not alter your DNA, and 95% said this is false, which is true. It is revolution in the vaccine industry. Just having the gene code, and it's proven very effective and way for vaccination. So vaccination, it's one of the most important medical discoveries in history. It's a method of injecting actually a weakened form of an infection into the body to prevent getting the disease later in life. So our body meets the deactivated form of the virus or bacteria and builds up the immune response against it. So it is able to fight off the infection if it ever meets it again. So it just, you're giving your body the tools and the fighters to fight that disease. Historically, women in Turkey used to make scratches on their sick kids who had smallpox and contacted it with the healthy kids' blood to make them ill again and gain immunity. So basically the first vaccine ever known was discovered was for smallpox vaccine. In 1798, it was discovered by Dr. Edward Jenner. So vaccines are very safe and historically proven to eradicate disease. Now there is a lot of disease that are history because of the vaccination and vaccines. So I think I have one slide here. So it just with the recent coronavirus pandemic, vaccines again become the most discussed topic. So when first Pfizer announced the discovery of COVID vaccine, it was the light at the end of the tunnel. So understanding how COVID vaccine works helps first look at how our body fights illness. So when germs such as viruses that causes COVID invades our body, they attack and multiply. This invasion, called an infection, is what causes the illness. Our immune system uses several tools to fight infection. Different types of white blood cells fight the infection in different way, like macrophage, the white blood cells that swallow up, digest the germs, B lymphocytes. They are defensive white blood cells. They produce antibodies that attack the pieces of the virus left behind by the macrophage. So the T cells, T lymphocytes are another type of defensive white blood cells. They attack cells in the body that have already been infected. So the first time the person is infected with a virus that causes COVID, it can take several days or weeks for their body to make and use all the germs fighting tools needed to overcome the infection. After the infection, the person's immune system remembers what it learned about how to protect the body against that disease. So I have here the diagram which shows, when you administer the vaccine, how your immune response will happen. So in Canada, so I think we can go to the third slide. The third one. So here, sorry, it's the first one, the second one here. So, so the types of COVID vaccines. So there is 3 types of COVID vaccines in development. So first is protein-based, vaccines, which is the traditional vaccines. And so when you give the part of the virus protein, and that will produce, it will act as antibody, and then your immune system will produce the immune response. Second kind is the vector, viral vector, which we give the spike protein gene. It's just a gene code. It's purified, and then it is covered with a adenoviral vector, and then it will produce, body will produce the spike protein, and then the body again will fight it and produce the immune response antibodies. And the third type of COVID vaccines are the mRNA vaccines, that the gene code of the spike protein, which is the main protein identified in the coronavirus. And then it's purified and injected. And this is really the first historically revolution in the manufacturing of vaccination. And then your body will produce the spike protein, which will trigger your immune system to produce the immune response. So in Canada, we have 2 types of the COVID vaccine were approved. The first kind is the mRNA vaccines, which is the vaccines for Pfizer and Moderna. The mRNA vaccines teach our cells how to make the COVID spike protein, and it will trigger creating of antibodies. These antibodies help us fight the infection if the real virus does enter our body in the future. So it is B cells response only. The second kind of approved vaccines are the adenovector vaccines, which is by AstraZeneca and Janssen. The vector virus within the vaccine contains the gene that produces the spike protein. And this has the advantage of triggering a strong immune response by the T cells, as well as producing of antibodies by B cells. The vector virus does not replicate, therefore the adenovirus cannot cause infections in the host. So can we go to the next slide? Okay, so here. So I have here a brief, comparison between the two mRNA vaccines approved in Canada. So the most talked ones is Moderna and the Pfizer. So in the Moderna vaccine, the dosing is 0.5 ml intramuscular injection, 2 doses 4 weeks apart. While in Pfizer vaccines, dosing is 0.3 ml intramuscular injection, 2 doses, 21 days apart. And now the BC Health Authority said that you can increase that interval up to 4 months. Moderna vaccine, the efficacy is 94.1% effective in preventing COVID, beginning the 2 weeks after the second dose, while Pfizer's vaccine's efficacy is 95% effective in preventing COVID, beginning of 1 week after the second dose. So basically, it's the full immunity will happen after the second dose in both of the vaccines. The side effects, it's pain at the site of injection, body chills, feeling tired, feeling feverish, and it's similar in both of the vaccines. So, so for Moderna vaccine, it's approved for people 18 years of age and older, and for Pfizer vaccine, approved for the 16 years and older. So we can see the comparison between the other kinds of vaccine. So next slide, please. Okay, so the adenovector vaccines approved in Canada, the AstraZeneca and Janssen. So AstraZeneca, the dosing schedule is 0.5 ml intramuscular injections, 2 doses 4 to 12 weeks apart. Efficacy is 62% effective in preventing symptomatic COVID disease 2 weeks after the second dose. While the Janssen vaccine, it's 0.5, it is a single dose. So the efficacy of that vaccine, 66 effective preventing symptomatic COVID disease beginning 2 weeks after the vaccination, the full protection after 28 days. So there was a lot of talks about the AstraZeneca vaccines, that it is linked to a blood clots, but review by Thrombosis Canada, based on the available evidence, that no link has been proven between the receiving the vaccine and the development of blood clot. Most statistics still, of course, going, but it was in the geriatric category, which already, unfortunately, they are at risk of having blood clots. So the side effects for the Janssen vaccine is the pain in the site of injection and the chills and the tired. Also they are both approved for the age of 18 years and older. So the government announced, of course, the vaccination strategies with 4 phases. So which was for phase 1, it is for the 1 and 2 for high risk, and phases 3 and 4, it's for the general public. So currently we are in phase 2, which will end in April, and we are looking forward for phases 3 and 4, which will mean more people hopefully vaccinated. So we all have to remember, it's very important, if you decide to take the vaccine, which I hope we all do, it's important to stay in the clinic for 15 minutes after getting the vaccine, because about 1 million of people can have a life-threatening allergic reaction. It's called anaphylaxis, and this may include the hives, difficulty breathing, or swelling of the throat, mouth, tongue, or lips. Should this reaction happen, your healthcare provider or you can treat it, or the emergency treatment, which may include the administration of epinephrine. So, so if the symptom developed after that, you can, call the 911. So finally, I believe getting vaccinated is one of many steps you can take to protect yourself, others from the COVID. Protecting from COVID is critically important because of some people, COVID can cause, of course, as we all know, serious illness or death. So we have to think of each other and act responsible towards each other and our community.
Awesome. Okay, thank you so much, Faiza, for your perspectives and really giving us a really comprehensive, very, very detailed, informative discussion and comparison of all of the different types of vaccine. I think being educated and informed and knowing the pros and cons and side effects is really critical when we're starting to talk about vaccinations.
True.
Yes.
Thank you, Zara.
Mm-hmm. Of course. So our last panelist is Imam Ismail Noor of Masjid Al-Iman. Imam Ismail is the religious leader of Masjid Al-Iman in Victoria, BC. He will explore the Islamic perspective, which a lot of the Muslims in the room today probably are keen to hear when we're seeking treatment for disease, as well as the social responsibility of Muslims to prevent the spread of diseases. He will also share the immense contributions of Muslims in the field of medicine and scientific research. So welcome, Sheikh Ismail.
Sorry, I always forget to unmute myself. I have to get used to that. Assalamu alaikum. I'd like to start off with Bismillah ar-Rahman ar-Rahim, in the name of Allah, the most merciful, the most gracious. And then to thank Hair Magazine and everyone that is involved in this effort, and the panelists for contributing as well. This topic, as we all know, is very, very important for a number of reasons, especially from the point of view of a Muslim, because we know that Islam touches on not just the spiritual aspect, the religious aspect, but Islam for Muslims is a way of life. So in Islam, we're taught about how to live and breathe this beautiful religion. Now, when it comes to the topic of medicine, I have to make it clear from the beginning that what I'm going to give you is no medical advice by any means. I can only share with you the Muslim perspective and what Islam teaches us concerning, helping others. And the panelists have touched on the medical aspect and have explained it very well. When people ask the question about vaccines, they say, for example, Imam, show me what verse in the Quran that speaks about vaccination, or show me the hadith from the Sunnah, from the traditions of the Prophet ﷺ that speak about vaccination. Now, the way that the religion is structured is that you might not find a verse from the Quran or a hadith from the Prophet, peace be upon him, that explain it in the same way that we might understand it today. But that does not mean that they would not, that these issues were not discussed and explained in different ways. We know for a fact that the Prophet, peace be upon him, gave clear instructions to the Muslims when it comes to things like disease in general. There's a hadith of the Prophet, peace be upon him, where he actually said, لِكُلِّ دَاءٍ دَوَاءٍ لِكُلِّ دَاءٍ دَوَاءٍ, meaning that for every single illness, disease, sickness, there is a cure. alimahu man alimahu wa jahilahu man jahilahu. For the one that knows it, that has come up with the cure for it, then they know it. And the ones that do not know it, they do not know it. And vaccines is part of that idea. Like the Arabs, they used to have a saying, and they still say it today. They say, al-wiqayatu khayrun min al-ilaj, which basically means protection is far better than any cure. If you're able to protect yourself before you need to seek a cure, then that is the best way to go about, medicine as a whole. Because once a person gets sick, then it might be difficult to find the right treatment for that particular illness or sickness or whatever it might be. And it is fascinating once you read into Islamic history, the contributions that Muslim scholars have given throughout the centuries in the past. Scholars such as Ibn Sina, who many non-Muslim scholars refer to as the father of medicine as a whole, his contributions, his book on the medicine and the human body, it is still referred to by many doctors today. And even more so, the Prophet, peace be upon him, himself gave very clear instructions of how to deal with epidemics, pandemics, outbreaks of disease. He gave instructions to the companions where he said, if anyone hears that there is an outbreak of disease in a particular land, then it becomes impermissible for a Muslim to travel to that land. And it becomes impermissible for the people that live in that land to leave that land, right? Today, what do we call that? We call it quarantine, to make sure that the disease doesn't spread, all over the place. And this was taught as a means of prevention, or at least to keep the disease, the outbreak, controlled to the best ability of the people. So you will see time and time again these kind of things coming up throughout Muslim teachings. And as a whole, Islam came to protect 5 things. Islam came to protect 5 things. These are considered to be the most essential things in life. So Islam came to protect ad-din, the protection of religion. And then Islam came to protect hifdun nafs, protecting life in general, whether they be Muslim or non-Muslim. Islam came to protect the wealth of people. Islam came to protect the honor of people. And Islam came to protect many of these things that are the core values in life. So the point that I mentioned about Islam protecting life, it ties very much together with this idea of vaccination. A person might say, I'm healthy, I am young, I don't need, there's no need for me to get vaccinated, there's no need for me to be worried about the coronavirus. But like the panelists mentioned, that, a person might not be affected, but if they have the virus, they'll be the person that might pass it on to others. And this is very much against Muslim teachings. The Prophet, peace be upon him, he said, La darara wa la dirar, meaning that it is impermissible for harm to be afflicted on you, and it becomes impermissible for you to inflict harm upon others. So the Muslim is the one who not only thinks about their own interests, but they think about the interests of people around them. So the Muslim should not be selfish. The Muslim should be thinking about the people around them, people who might have compromised, immune systems, that might be elderly and so on. And one very important point that Sister Asma Shifa pointed out was this stigma that people often associate with, different illnesses and disease. As soon as someone gets let's say in this case, COVID-19, people start judging the person, right? They might say, who brought it to our community, as if, they want to find that culprit or that person that is patient zero or whatever you might call it. But Islam teaches us that anyone can get this disease or any other disease. Even the Prophet, peace be upon him, he fell sick more than once, and he recovered. And in his final illness, he became sick, and he passed away because of that illness, that sickness. So we really need to target this this stigma that is found within our community. That if someone, you might be able to take all the necessary precautions, and you do everything that you need to do, right? At the end of the day, as Muslims, we believe that whatever is meant to happen, happens, right? Ma sha Allahu kan wa ma lam yasha lam yakun. That whatever Allah subhanahu wa ta'ala has decreed, then that will happen, and whatever Allah has not decreed will not happen. So for us, the only thing that we can do is to take that those steps that are needed. Another thing that I wanted to touch on was the spread of fake news, as they call it these days. There's nothing wrong with being skeptical from a Muslim perspective. There's nothing wrong with being skeptical and to check things thoroughly. But there's a huge difference between being skeptical and dismissing the opinions of experts. And it's very sad to me as an imam when I hear people saying, I don't need the opinions of experts. The opinions of experts is the exact opinion that you need. If you don't take your opinion from experts, who are you going to take your opinions from, right? And this idea of verifying the news and to make sure that it is authentic, it is very much part of our religion. Allah says in the Quran, فَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنْتُمْ لَا تَعْلَمُونَ. Ask the people of knowledge if you do not have it yourself. So to seek out whether it is medical knowledge, you go to the doctor. If it's religious knowledge, you go to the imam, right? And you cannot go to the imam and say, my stomach hurts, because the imam is not specialized in medicine. Similarly, you don't go to a doctor in medicine asking him about a religious verdict, because that is not their specialty. So this needs to be reinforced time and time again, that when it comes to knowledge, the whole religion is based on this knowledge. What was the first revelation that the Prophet, peace be upon him, received? It was not a command to pray. It was not a command to fast. It was not a command to go for Hajj. It was Iqra, read. And this reading and this pursuit of knowledge and verifying the knowledge, it is something that our religion teaches us from the very beginning until the very end. So no Muslim should dismiss the opinion of someone who has the actual knowledge. Along with this, there is a concept in Islam that the scholars usually refer to, and it is the concept of tawatur. Meaning, if something is mutawatir, it means that it has been passed on or accepted by a great amount of people. Usually, once something has gone beyond a threshold, then Muslim scholars would, in that case, say it is highly unlikely for all of these people to all agree upon something that is wrong, at least from a Muslim perspective. One person might be wrong, two people might be wrong, three might even be wrong. But once you start talking about great numbers, then the likelihood of each and every one of them being wrong is something that is not Islamically viable. So this is how we have understood the Quran. Why do we think of the Quran as authentic? Because it's been passed on by generation after generation. So if a scholar, let's say a medical doctor, has come with the cure for cancer, just as an example. And they are the only one. Yes, a Muslim should be skeptical then. Where are the tests? Where are the peer reviews and so on? But if you have multiple doctors around the world that are all saying with the same voice that this is something that they would back with their knowledge, then the Muslim is the one that accepts that sort of knowledge, and Allah knows best. And inshallah, with that, I'll pass it back to Sister Zara.
Jazakallah, Imam Ismail. Your leadership, as always, is we're so grateful to have your leadership, especially with this dialogue, but overall just with throughout this pandemic and really leading us and guiding us in these conversations. So Jazakallah. We're going to move on to our Q&A. So this is really the bulk of the conversation. And like Imam Ismail pointed out, we are grateful to be surrounded by experts in their own rights. And so it's really on us to utilize this and ask as many questions as we want and make sure that we're taking advantage of this conversation today. So please, as always, use the chat box and add additional questions. And we've already had some questions coming in, so we'll try to address those now. So I'd love to direct our first question to Dr. Murthy and Faiza, but again, any of our panelists can take this up if they feel they want to contribute. But one of the questions was, as Sister Faiza addressed all the vaccines that were kind of available, are they safe? And specifically, are they safe for pregnant women? And you're muted, sorry, Sister Faiza.
Yeah, sorry. So actually, it's a very good question. The vaccines are, of course, they are not studied very well for pregnancy, but I mean, the benefit of getting the vaccine outweighed the risk in so many cases, and especially in pregnancy. So if the pregnant women have a high risk of getting COVID, getting the vaccine would be a best option because the complication of having COVID, it's very risky, especially for the pregnant woman. So yes, but still the data are coming, more and more, statistics are coming. So for now, it is not, it's not recommended by the manufacturer, but the benefit always outweighed the risk. I don't know if the doctor wants to add anything.
No, that is correct. The manufacturer can't say anything one side or the other, but I can say that tens of thousands and maybe even millions at this point of pregnant individuals have received the vaccine, acknowledging the risks and benefits. And there haven't been any reports of any major issues with people who are pregnant receiving the vaccine. Clinical trials are underway to make it more formal, A, and B, it's, like I said, been in sort of recommendations by various guideline groups saying that each person can make their own decision. There's no biological risk. The types of vaccines that are being given for COVID-19, there shouldn't be a major risk to the developing fetus with these types of vaccines. And so we don't think there should be an issue with pregnant people receiving it. So hopefully we get more confirmation of that in the coming weeks and months.
Thank you both for that response. I'll jump into another question, and this time it's directed at Sister Asma. So we had some earlier questions during your speech, and one specifically was, how many people have you assisted with a respirator or ventilator?
Well, right now I work in with the intravenous therapy, IV team, they call it, with the vascular access team. but my full-time job is in respiratory. I have taken care of patients who's in the ventilator, but not with the COVID patient, because usually when patients need to go to when they need to be intubated, when they need to be intubated means they have to be breathing by ventilator. So we send them to the ICU. So in the ICU, I've seen them because I work as a vascular access team. I go for teaching and some kind of education and then help assist them with the intravenous insertion access and then other like a PICC line. I don't know if you guys, it's a little bit medical conditions, but I have seen it in the ICU, but I have taken care of ventilated patients, but not with the COVID positive. The only patients that I've taken care only with COVID patients, just they need regular nasal tube oxygen.
All right, thank you for clarifying
You're
that.
welcome.
And another follow-up, just because it was related to your conversation as well, was when you talked about Ahmed in your speech, did he have any underlying conditions?
In the article, it doesn't say he had any underlying conditions. He was healthy. He was very in a great shape. And it didn't mention anything he has underlying condition. And then that's why maybe helped him to recover quickly. Not quickly, but he wasn't fully recovered when I read the article. It's everybody can read it, the article, or they can go to website, but it didn't mention he had any problem with the underlying condition.
All right, thank you. All right, and we can kind of direct a general question to all our panelists. There's been questions on if someone has had COVID, should they still get the vaccine? So I can direct this maybe perhaps at Faiza, since you talked about it, or Dr. Murthy, but again, anyone can jump in on these.
If someone gets COVID, looks like that the study shows that they might contact COVID again, and it happens that they are symptomatic again. So when you get the vaccine, I think it will produce memory, and that's why the vaccines usually is 2 doses, which is the first dose, it's a primer, and the main immunity happening after the second dose. So in my opinion, yes. I'm not sure what Dr. Sirvans will think about it.
No, you're correct. And so, yes, the people who have had the COVID before, even confirmed disease, should still get the vaccine. And that's because we don't know what the immunity is after a natural infection. We know the immunity after the vaccine, and we've tested it and can feel confident that your antibodies are good after the vaccine. And so everybody, including those who have gotten COVID before, should be vaccinated.
Great, thank you. A little bit of a follow-up to that question as well, as there's some questions on, has anyone actually died from the COVID vaccine? And then if they have, do you know how many specifically? So again, I'll direct it again to probably Dr. Murthy or Faiza or Sister Asma, if you'd like to jump in.
Sure, I'll take the first stab of this. And so it's in the clinical trials, testing across hundreds of thousands of people, no one has died from receiving the COVID vaccine. Now that we've given it to tens of millions of people all around the world, people have died after receiving the COVID vaccine. But we cannot say that it's because of the COVID vaccine, because of the tens of millions of people who have gotten the COVID vaccine. Say if you get a heart attack, or if you get hit by a car, or something else terrible happens after you receive the COVID vaccine. Some people can think that that's related to the COVID vaccine, but it's unlikely to be caused by it. And we need more sort of monitoring and more people to get vaccinated to be very confident of any sort of signal that we see of adverse events or very rare events are real or not and related to the vaccine.
Thanks for addressing that. Again, you can go back to the saying correlation isn't always causation to sum that up, but if Faiza wants to address this as well, you can jump at or we can move to our next question.
No, I agree with Dr. Srinivas. There has been this, but it's not, there has been this that one person was in the news, he already had COVID and then, get the vaccine. There's a lot of talk about the allergy and anaphylactic reactions with the vaccines, but I know, for example, for the Pfizer vaccine, the main ingredients of it's water, salt, and something called PEG, polyethylene glycol, which is available in food and so many basic medications. So allergic reaction, anaphylactic to Pfizer vaccines. I'm not talking about the other ones, so it's not high, and it is very safe to be given.
Great. Okay. And so I'd love to direct a question now for Shah Ismail. So there is a question or kind of like a thought on, is a Muslim considered guilty if they refuse the vaccine?
That's a very good question. In my opinion, it is a little bit of a gray area. If the Muslim is neglectful, does it out of neglect, meaning that they can't be bothered, they can't be asked to look into it, then yes, there is a responsibility there that has been left. But if a person has the knowledge and they've done their own research, at least from an Islamic perspective, you cannot say that they are sinful in that case. If they firmly believe that this is, something that might cause them harm based on firm knowledge, then from a Muslim perspective, that is accepted. But again, I would advise brothers and sisters that don't rely on your own knowledge alone, but look at the collective knowledge of medical professionals. So it's very easy to find that one doctor that will say what you want to hear, or the two doctors that will tell you exactly what you want to hear. And then on the other side, you have thousands, if not millions, of doctors that all say it is safe. So as Muslims, we go with the Jamhur, meaning the larger body, whether it's religious questions or non-religious questions, because the Jamhur, the larger body, they're less likely to be mistaken, and Allah knows best.
Jazakallah for addressing that. I'll direct some questions to Sister Faiza, since you talked about vaccines and the different types. There's some questions about, do we have a choice between the vaccines? And you also talked about phases, so I'm going to jump into the next part is, when you address phases, can you be vaccinated before our age group? So two kind of questions in one.
I think the government announced the vaccination strategies now, and it's depending on the vulnerability and also on the demand and supply. So for now, looks like that we are in phase 2, and it's all controlled by the in the island by the Vancouver Island Health Authority, and for the this phase, it is for the geriatric geriatric and 80 and plus. So the vaccine looks like it's mostly Pfizer vaccine. It's being provided. In the government policy looks like that the AstraZeneca, it will be for the mass, for the younger age group. So we will expect that in phase 3 and coming phase 4. But for now, it's I think from what I've seen, from my patients, when I ask, did you vaccinate it? They say yes. I ask which vaccine. Mostly it's Pfizer vaccine has been administered for the geriatric patient, looks like.
Thank you.
Can I jump in there? I had vaccinated already, the first one, and I got Pfizer. And, I haven't seen any reaction at all. And many of my colleagues, almost all of us, we got vaccinated Pfizer, all of in Jubilee Hospital, because I work in Jubilee Hospital. We all co-workers, we have Pfizer, and I haven't heard anybody that have side effect or it. I just want to clarify.
Thank you. It's always good to hear and see the experience of those that have actually been vaccinated and hear the true stories. So that's always awesome. Jumping in on vaccination and moving into this a little bit deeper. Sister Esma, you can discuss this if you've had your second shot yet, but there's some rumors around the second dose being fatal. So Faiza or Dr. Murthy want to jump in on, is it actually fatal to get the second shot, and why would you need a second shot if the first one already provides you with enough antibodies?
So the first dose, will give you the first immune response when you're giving the antigen to the body, and the body is producing the fighters, which is the antibodies. So you are getting immunity, but it is not the 100%. So, but when you expose next time, the body will say, "Oh, I know this," and then you will have the second level of immunity, which is the memory. So, and you will have like the full immunity when you get the second dose. So first one is like a premium, and the second one is actual, the full immune response happen when you get the second shot.
If there's anyone that wants to jump in on this, if not, we can jump to a new question. Okay.
I think Johnson is only one shot, I guess. Isn't it, Pfizer?
Yes, that's right.
Yeah.
I think Johnson vaccine is just one shot, but they still now it's in the statistic, but they're saying it's 66% effective, while when you're taking the two doses, it's like 94% effective. That's, the research, but of course it's more statistics coming. It's because of the kind of it's a vector vaccine for Johnson & Johnson versus like mRNA for the Moderna and Pfizer. So it's a newer technique.
And concerning the different types of vaccine, there's some confusion in the community that's saying the mRNA technology has not gotten final approval from the US Food and Drug Administration. Faiza, would you like to address or perhaps debunk that?
It's when COVID, when the scientists studied COVID and they found that like the gene sequence of the spike protein, and looks like that it is the same gene sequence in the spike protein is the same even in the mutations. So that was like, oh, we found a solution. So when they did the mRNA, vaccine, it's based on that gene sequence. So So we are giving like our body a gene sequence, a protein. It's we are not giving our body a harmful virus, or it's a gene sequence or a protein which our body attack and produce weapons against it. So I think it's a very I'm so excited because it is as a traditional vaccines, you have to put the vaccine in agar or in a culture where it's a glow, and that could be like egg yolk. So a lot of people who has allergy to egg, or they are a little bit hesitant or can produce problems, but with this vaccines, it's minimum other materials used. So it just like the sequence of the genes. So that's why I think it's safer.
All right. Okay, so anyone can jump in on this, but can someone speak to the whispers about the vaccine being unethically tested in Africa, specifically Central Africa and Kenya?
I can answer that. And so these vaccines were all tested in different parts of the world. And the Pfizer one was predominantly tested in the United States, as was the Mrna one. The AstraZeneca one was tested internationally. There was a trial in Brazil, a trial in Europe, and a trial in the United Kingdom. I have not heard those whispers of unethical trials in Central African Republic. Obviously, if that was an occurrence, that would be a major problem. It's important that we remember that vaccine access is a very important thing for many places in the world, and that we should be very grateful that we have the access to the vaccines that we do, while many other parts of the world do not.
I agree. I think the unethical is that we have to have equal access as a global to the vaccine. It's it's fair that the vaccine will be more widely available to the all world and all countries, especially the countries under the poverty line.
So starting to think a little bit in the future, there's some questions on when we get the COVID vaccine, will it be like a flu shot that you kind of take every single year, or do we have some direction on what that looks like? And I guess it might be a hard question, but anyone can jump in on it.
Yeah, it's a hard question, and we don't know at this point. It's probable with the rate at which this virus can change and evolve, as we've seen with these variants, that there may need to be new vaccines that are given every so often, every year, every 2 years, to reboost or reprime immune systems. There's also the possibility that in a couple of years, we'll need a booster dose to make sure our immunity is still there, like we do with other vaccines, like measles. We give a couple of doses in kids, for example. And so there's all sorts of possibilities as to what's going to happen over the next few years with the vaccine and coronavirus. And we can't answer them yet. But just once again, it boils down to making sure the science is there and the vaccines are available and accessible to the people who need it.
Thanks, Dr. Murphy. We're starting to kind of cut down on our Q&A time, and just to respect and honor our panelists and the time and effort that they're putting in this conversation. We just want to stay on track. So I know that there's a lot of other questions coming in, and people are starting to think upon things and really gather them in. So hopefully we can have our panelists, you can direct them at another time or another conversation to kind of get those questions, and we'll build in some resources and some tools so that some of these questions that we didn't address today can be answered as well, and hopefully a follow-up. So we're going to start to wrap up our conversation today. And to do this, we'd really like to gauge how everyone's feeling so far, and just how everyone feels at the very end of the night. It's late into the evening, but we'd love to see how you feel. So again, another poll will be popped up on your screen. And so feel free to reflect and take a second to see how you feel. All right, so we'll give it just maybe 30 more seconds for everyone to just answer, just a closing reflection and to kind of ground us. I know a lot of heavy conversation came out of there, and so we just want to make sure we ground ourselves again, ending this conversation. All right, so we will end our poll there and just see how we all collectively feel after this insightful but informative conversation. So a little bit of a split, but it's nice to see that some of us are feeling calm, reassured. Some are a little confused, which hopefully we can kind of start to address when we can all personally just start to educate ourselves. I think this conversation is just the start to a personal journey of understanding and reflection. Again, it's great to see that 35% of us are feeling informed, which was really the critical point, and we wanted to make sure that everyone felt informed. And there is some anxiousness, but again, when you're in the middle of a pandemic with a lot of heavy, loved ones, reflecting on how our family feels and having deaths and everything. So there's a lot of anxiousness surrounding this conversation, but closing it off, we all feel very optimistic when we're starting to move into this phase of vaccination. So it's a critical conversation. So thank you all for engaging in this poll and reflecting with us.
If I may just add a summary very quickly, because we touched on a few things, especially with the Islamic aspect of it. So if someone was to ask, what does Islam say about vaccines? The short answer is Islam encourages us to rely on the experts. Islam encourages us to rely on the experts in the field. So if the medical doctors, the scientists have said that this is safe and should be done, then that is what Islam would encourage, and Allah knows best.
Great. Jazakallah, Sheikh Ismail, for addressing that and kind of summing up the conversation today as well. We're really grateful for all of these panelists to bring their voices to this conversation and their experiences as well. Their leadership within the community, whether as educators or frontline workers, has really kept us informed and safe throughout this pandemic. Again, we hope in this dialogue you've gathered an understanding and felt informed about vaccines and COVID overall. As always, this event could not be possible without Here Magazine and their continuous efforts to create safe spaces for community voices. They're an amazing platform for amplifying immigrant, refugee, and underrepresented communities. Make sure that you check out their website and subscribe to Here Magazine. Additionally, I just wanted to recognize the leadership within Masjid Al-Iman, creating this partnership with Here Magazine and this event. Leaders like Sisters Lisa and Sister Zahira pushing with such perseverance and purpose throughout this pandemic. And as always, Imam Ismail for being a driver in this conversation and leading our community with the religious background. So for those of you that joined from the Muslim community, or if you joined from the greater community, let's make sure that we continue this conversation and keep each other informed. We have such a diverse community with different backgrounds who are medical practitioners, healthcare workers, and educators, and we can reach out to them as credible sources and go back to when Sheikh Ismail was talking about not pushing through with false information and using those sources as where we're gathering a lot of this information for vaccines. So thank you everyone for joining, and we hope you have a good night, inshallah. I know that there's some of us still feeling like we didn't have our questions answered, but again, this is just a starting point and that start of a conversation and a journey to being informed. So please make sure to keep those questions in the back of your mind and to reach out to those credible sources like the ones that we've spoken to today. So assalamu alaikum, and thank you everyone.
Thank you so much, Zahra. Thanks for doing a great job.